I'm Kelly. I've been on Humira since April 2007 and I use Humira because I have rheumatoid arthritis. I use Humira once a fortnight and to remind myself I mark it on my calendar. A doctor or nurse will tell you when to start taking your drug and how much you'll need. It is important to keep Humira in the fridge because it needs to be kept between 2 and 8 degrees centigrade. You should always read the patient information leaflet before taking Humira because it's got important safety information in it. I use one pen once a fortnight, but there are conditions that may require more. It's best to check this with your doctor first. It's called a pen because it looks like a pen and has a click button at the end that you press when you inject. Each pen contains a 40 milligram dose. It takes me between 10 and 15 minutes to prepare for my injection. You can do your injections wherever you choose to. I tend to do mine in the kitchen, but wherever you do decide, it is important to keep a sharps bin nearby. Before I take my injection, I put my pen, cotton wool and a wipe on a clean surface. You need the 10 minutes prior to injecting so you can do a series of checks. First of all, you need to check the expiry date on the pen. Then you need to make sure that the liquid is clear and colourless. And finally, move the pen to make sure that the liquid is not frozen. It's okay to move your pen, but it should never be shaken or dropped. I inject into my stomach, but you can also inject into your thigh. It's important not to inject in the same place twice in a row. First of all, I wipe my skin with an alcohol wipe. Now if you look at the pen, the grey end is the needle end and the plum end is the button that you push to inject. When you're ready, push the button. You will hear a loud click. Hold with constant pressure for about 10 seconds and wait until you see the window on the pen turn yellow. When I inject, I feel a slight sting, but it doesn't last very long. Almost there now. Finally, apply pressure to the injection site with cotton wool. After injecting, throw everything into the sharps bin. Remember not to put the caps back onto the pen. That's it, me done for another 2 weeks. I'm on Humira because I was diagnosed with rheumatoid arthritis. The medicine can also be used for people with conditions such as psoriatic arthritis, psoriasis, ankylosing spondylitis and Crohn's disease. The most important thing for patients to remember is read the patient information leaflet and if you feel at all unwell, consult your doctor. I tend to go on holiday in between my injections, but if not, I always make sure there is a fridge I can use where I'm going. It is important to carry your medical card around with you at all times because it contains important information in case of an emergency. When I was first prescribed Humira, I did feel quite nervous to start with, but now, after each injection, it seems to get easier and easier. It just seems like second nature to me now. If anything went wrong, I would contact my doctor or specialist nurse immediately. If you're new to using Humira, my advice to you would be to follow your doctor's advice and just look after yourself.